You might be wondering how the Get Paid to Save colonoscopy campaign from HealthEngine works. Before I dive into the specifics, I wanted to explain to you why we're doing this. So, a little bit about colon cancer. First, it's the number 2 cancer killer of men and women in the US. However, it's preventable and it's curable 90% of the time if it's diagnosed early. The sad reality is that only 60% of those who need a colonoscopy or some other form of screening actually get one. At HealthEngine, we decided we needed to do something to change this, and the Get Paid to Save campaign was born. There are two ways to engage with us on the Paid to Save campaign. The first is if you need a colonoscopy. The second is if you know people who need a colonoscopy. So first things first, if you need to have one, we have a variety of providers across the Chicagoland area who have agreed to participate with us in this campaign. They are offering various levels of discount. When you request an appointment with us, we're going to take you to a form. We're going to request some personal information about you. The primary driver behind needing this information is because we are going to schedule an appointment on your behalf. Without this information, we can't do that. So you'll see we're asking for first name, last name. We're asking for where you live because if you're eligible for a refund, we're going to need to send it to you. Email is important because that's how we're going to exchange information. You'll notice birth date and insurance information. Again, the only reason we need this information is because we are booking an appointment on your behalf, and the facility is going to ask us for this information in order to schedule you. You'll also indicate your preferred date and time. Click Request Appointment. Once you've done that, we're going to follow up with you. Our care concierge team will send you an email with all of the providers available to you to choose from. You're going to let us know which one you prefer, and we are going to schedule the appointment for you, confirm that the screening will be 100% covered by your insurance, and confirm the amount of the refund. We'll also make sure you have all the information you need in order to be prepared for the colonoscopy prior to having it. So scheduling is really very simple. The other way to engage is to what we call share some good colon karma. Click on the spread the word link, and all we're going to need from you is an email address. So I'm going to enter my email address, and what's going to happen is I'm going to get a unique code. The thing that's great about this code is I can choose to share it in a variety of ways, either on social media or via email. Anyone who sees this code and uses it to book an appointment is going to generate a referral for you. What that means is if you email this code to 10 people and 5 of them ultimately book colonoscopies through the Get Paid to Save program, we're going to give you $25 for each of those people. So the more people you share this with, the more people you get this in front of, the greater your potential, first, to do good, and second, to get paid for doing good. So at HealthEngine, we really want to thank you for helping us get this campaign in front of as many people as possible so that we can improve that screening rate from 60% to 80% and hopefully help someone avoid a colon cancer diagnosis.